space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome to the Confidence Doc podcast. I'm Dr. Vinaya Rednam. I'm a board-certified plastic surgeon in Houston, Texas with my Houston surgeons. And we have a special guest today, Dr. Karishma Reddy. Thank you so much for joining us.
My pleasure. Thank you so much for having me on. I don't even feel worthy of being on your podcast, but I appreciate the opportunity.
Oh, now, everybody is worthy of being on here. This is a really fun show because we talk about literally anything. We are obviously definitely going to be talking about you as a brilliant plastic surgeon, but we could talk about anything because you never know where the conversation goes. So, Dr. Reddy, why don't you tell our listeners just a little bit about you? How did you end up as a plastic surgeon?
Yeah. So I think, we kind of share some parallels. I do come from a family of doctors. My mom is a family practitioner. My sister's an OBGYN. And so from the jump, healthcare was pretty heavily involved in my life. I spent weekends as a kid, rounding with my mom, being dragged around to the hospital or clinics or whatever. And then, kind of reluctantly fell in love with it. I wanted to be anything but a doctor. I was like, I'll be a lawyer. And my parents were like, you're too dumb to be a lawyer. You just have to be a doctor. And I was like,
thanks.
Okay. I guess I'll just be a doctor. That sounds easy. But truly, just being exposed to different aspects of the medical field, quickly realized how fulfilling patient care can be. And then, when it comes to plastic surgery, I think we're one of the amazing surgical subspecialties where psychology and patient feelings and emotions are so heavily tied into what we do, which is very different than almost all other surgical fields.
Mm-hmm.
I remember being a med student and there was very little emotions, feelings. It was really just meet the patient, do the surgery, and get out. But this field, I feel like we really can connect with patients on such an incredibly deep emotional level. And I think you can see such a change in people's suffering and a lot of their improvements in confidence through surgery. And that was the perfect marriage for me when I found plastic surgery.
I love that. I mean, for me, that was the same as we build relationships, right? I mean, I have patients I've had for years now, and then you take care of their mom, and then you take care of their sister. And it's so different than general surgery, right? Where, after a certain amount of time, you're like, okay, well, you're doing good. Bye-bye.
Yeah. There's only so much emotion you can tie to your gallbladder, but your body, you're in 24/7. And whether we like it or not, we develop such a deep and complex relationship with our bodies. It carries you through, whether it be a weight journey, pregnancies, bring your kids into this world. There's so many different emotional aspects that your body carries you through that there are a lot of feelings tied up in it.
I know, and that's what makes it so fulfilling with what we do. So, one thing I've not touched on a lot is how we become plastic surgeons, like the different types of training programs. What kind of training program did you do? Were you an integrated resident or did you do the traditional path?
Yeah, so I went to med school at the Medical School of Georgia, and then I went through the integrated pathway at the University of North Carolina, Chapel Hill. So what that means is a fourth-year med student, you graduate, and so at 25, I started residency. It's a 6-year program, and I think it's great because the first 2 years you do a heavily immersed general surgery rotations where, you're doing the traumas, running codes, learning how to take care of sick people, which I think all surgeons need to know. But then the last 4 years of that residency really hones in on plastic surgery and all of the different aspects of it. And you trained integrated, right?
I was integrated as well. Yeah.
Yes.
So, for our listeners, the traditional path, you do 5 years of general surgery, and then you have to reapply to get into a plastic surgery fellowship. And honestly, that was very common. Integrated residencies were not that common when I was applying and going through that. And then now it's switched to where we're seeing not just plastic surgery, but even other surgical subspecialties are starting to do this more integrated path because potentially we don't necessarily need to know how to do advanced laparoscopic surgery. It's not really necessarily in our wheelhouse.
Yeah, I love it. And I think, time is precious. It's the one commodity you can't buy more of, especially for females. Every year is so important. If you're thinking about planning for a family, et cetera. And so I think it's a great option. The integrated pathway still makes you an incredible surgeon, but really hones in on what you're trying to be at the end of the day, which I love. I think it's funny though. I do see patients on Facebook groups or, I think it's touted as if you're double board certified, that means you're like an even better plastic surgeon.
Yeah.
It seems like a huge misconception. So double board certified in some aspects means you went through the general surgery training, got your board certification in general surgery, and then went to your plastics fellowship and got that certification. But double doesn't necessarily imply better or more. But I do find that being confusing.
I love that you touched on that because a lot of people will say double board certified and you're like, in what?
Right.
Right? Like, because you could be double board certified and none of them be plastic surgery and you're trying to do cosmetic surgery, right?
Yeah.
So it's important to understand the differentiation between that because there are people that could have lots of boards that are relevant to it. But yeah, it is sometimes purposefully ambiguous because it's a marketing strategy.
Yeah. And I feel for patients, I think it's so confusing to understand our training and our certification. If someone's cosmetically board certified, does that mean that they're more specialized in aesthetic surgery? No, but it's quite the opposite. But, it is so confusing for patients to understand training and find surgeons that are qualified and good at what they do.
It is. I mean, I've had other physicians actually be confused by it, right? And that's also like a common misconception is that if you're a doctor, you understand everything about every specialty. I mean, we learn a little bit about everything in medical school, but once you narrow into your field, you kind of don't really know what's going on in these other fields. So you may not actually know all the details of it. And so it can get really confusing to know that, oh gosh, this isn't actually a real specialty. Someone's just kind of created it. So
yes.
It's a very, very good point. And moves us to my next point is like, you got to do your homework, right? When you're looking for somebody.
Yes. Yeah, absolutely. I think we're getting better at that. And patients are taking a lot more of that onto themselves in terms of research. You've done an amazing job at social media and letting your patients kind of feel you out, understand who you are before they even ever meet you. I think you did that kind of ahead of the time. Now I think that's all the rage, but I love your social media. I think you do a great job of that. But I do think social media, Instagram, it gets a lot of flack. There's a lot of trolls. There's a lot of negativity, but it's given us so much more ability to directly connect with patients and not like a weird fake way. And it's so much easier to just be your authentic self and let patients find who's going to fit their personality best, get to know me better as a mom, as a surgeon, as a person before they ever come to the clinic, which I think is amazing.
Well, and just like you said, our specialty is a lot of emotions and it's personal. So you don't really want the surgeon that's going to tell you what you need, isn't going to be kind to you, isn't going to, like those days are over, especially in our specialty. You want somebody who you can be honest with, talk about your feelings, make decisions together. And you're only going to know that if you get an idea of who they are beforehand.
Yeah, absolutely. I think it's so great that our field is changing so much. It's not this stuffy white coat, like, I think this will be a great implant for you and we'll see you in 1 week and then never again. Like that feels so not authentic.
I can't imagine doing that now. I'd feel like I was abandoning somebody.
Yeah, it just feels like you're doing them such a big disservice to not like really get to know them and understand what they're looking for.
So what's your focus? Every one of us kind of, a lot of us do, like I would say I do a lot of different things in plastic surgery, but we all kind of have areas we love and focus on. What would you say is your favorite areas?
Like surgically, I love breast and body. I've kind of always gravitated towards that. I love a huge transition from post-pregnancy and helping people regain their body and their confidence from that. So that's definitely my focus. I kind of feel like facial plastics has become such a involved world in itself, and I don't have a big interest in trying to delve into like deep plane facelift, rhinoplasty. I love to stay in my lane and just stay breast and body, and I love it. I mean, I think it's just such a gratifying field for sure. But I see your work, and I think you're doing a great job. You have so many awesome like massive weight loss cases. I think both of us do gender affirming care. And that's a pretty big part of my practice that I find really rewarding. And so it's been great. That's kind of what I focus on.
I too. I think the breast and body are my first loves. I do quite a bit of facial as well. I stay away from rhinoplasty because that has become such a super specialized area. And truthfully, like I just, I understand. Like I will happily refer to people I know are amazing at it. But I think that you also have to have a real passion for anything you do. Otherwise, you just never get better at it.
Yeah. And I think the other thing is like, breast and body alone that's a lot. And
it's plenty. It's plenty. Yeah.
One of the greatest things about plastic surgery is, you kind of have to accept that this field is going to be constantly evolving, pushing, getting better. The technology's changing. And so I think just the pressure to stay up to date and do those things well is my drive. I'm not trying to always add more and more and more different surgeries to my protocol. I'm just trying to just stay on top of the cutting edge and do my best in those areas.
I agree. And I think at some point you do have to pick kind of your focus because you want to really hone in and become the best you can be at those. And so that's what for me, like, I really loved the weight loss procedures. And so it's like, I do like focusing on that. And then it's, you bring in what you put out, right? So because that's what I show a lot, those are the people I get to see. And I love being part of those journeys. Like I feel like I make butterflies. And so it's exciting. And, it sounds like you do take care of a lot of moms, you said?
Yes. Yeah. I think that's like probably a big proportion of my practice.
So how do you explain that? Because that's a really common question people have. They're like, okay, how do I know when I'm ready to have my mommy make? Or if that's the term you use, I know that's become like a bad term to say, mommy makeover, mom, whatever you want to call it. Like what's your usual timeline that you talk to patients about so they have realistic expectations?
Yeah, I mean, I think the first thing is, and this is something I struggle with, is like the first question is like, are you done having children? I think that's been my biggest holdup on myself getting a tummy tuck or any breast work is like, I'm like, should I have one more child? So I am currently trying to figure that out. And I think a lot of women who are kind of in my same place, they're talking to their partners, trying to figure out, that's the first thing. Like, are you done having kids? Because you really don't want to have all this work and then have a positive pregnancy test and be like, oh, we're going to do this again.
Yeah.
So that, and then,
it's sadness for you and your plastic surgeon.
Yes. I'm like, no, but congratulations. Yes. So, that's the first hurdle for me. And then, I do talk to women. So I feel like that first 3 months after you deliver, there's a lot going on for those women emotionally. I feel like when I had my kids, I would look down and be like, oh my God, what is happening? So I think just on Instagram, where I'll message with them and kind of walk them through those changes. But pregnancy, as we know, brings so much inflammation. There's so many hormonal changes. You don't want to talk about actually doing surgery until I recommend waiting at least 9 months to a year out from your delivery date before you have surgery. But, the consultation process can begin before that. Things I want my patients to be done with. I want you to be 6 months out from breastfeeding so that your breast can really return to what may be sad, maybe not. Some people get lucky. But you want all of the breast milk to dry up. That's going to reduce your rate of infection. You want your breast to resume what it's actually going to look like post breastfeeding. So 6 months out from that. And then, as far as weight goes, I think it is really hard and people really struggle with trying to get off that baby weight. I know for me, I really hit a wall around like I was 15 pounds away from my goal weight. And I think one of the greatest advents has been semaglutides. No shame. I use semaglutides, not voluntarily. My mom basically was like at 9 months was like, do you want to try Ozempic? And I was like, me?
Mom, thanks.
Yeah. she's rather blunt, no filter. And I was horribly offended. And the next day I was like, fine, I'll try it. But this was back in 2019 when this was very not being used outside of diabetes and obesity. And so, but I did use it, and it really helped me in terms of getting back to my goal weight. Because that last few pounds can be so stubborn. But I think getting within 10 to 15 pounds of the weight that you're going to be happy at is also a goal I try to set for my patients before we engage with surgery. Because the last thing you want to do is have a bunch of plastic surgery and then lose like 30 pounds or more.
Well, and I'd love to hear that you talk to people before, because there are a lot of plastic surgeons who won't even entertain it. And it's like, I mean, that's already building a connection, right? So you're already earning trust there. I will tell you, I actually, as soon as I had my second daughter, I knew I was done. And I booked my surgery like a week after. I was like, okay, I'm giving myself a year to get in shape. And I was like, I knew exactly the date I wanted to do it. And I wouldn't suggest most people do that. I obviously have a little different insights as being a plastic surgeon, but I get it. I was just like, I know what I want. I'm done. I'm ready. I'm going to give myself that time to get in shape, and then let's do this,
Yeah. Like for me, it's not a like if, it's just like a when. I know I'm going to have my tummy tuck. And I think it's funny because when I say that to patients, they look at me like I'm crazy. And I think that really, sometimes I think there's a big misconception, like tummy tucks are only for people who are overweight, et cetera. Like a lot of patients, I think, or people in general have a preconceived notion of like who gets a tummy tuck. And I think, me and you understand that is such a versatile operation. There is no one single body frame that comes to mind when it comes to tummy tucks. A tummy tuck patient can look like all over the board. CrossFit patients who are ripped are having tummy tucks. It's not about obesity or being overweight.
It's really just about how your anatomy's changed, right? And like you said, you don't know what's under people's clothes. Like, so we are all human, and we all have our insecurities, right?
Yeah.
So Meta, for example, is changing up some rules now. So, now we used to be able to put ads out that had before and afters, right?
Right.
So you could compare. Well, now it's becoming that you cannot do that, because the implication is that by putting a before next to an after, that you're saying something was wrong with that person before. Like, what are your thoughts on that? Like, how do you feel when you hear something like that?
It's just so painful. I think, before and afters just help patients. Patient education is always our number one goal. We just want to use social media to help patients be as informed and educated as they can. And before and afters are a great way. At some point you can't doctor it. It is your work and you got to stand by it. And I think us as surgeons do that way more than any other field of surgery. We just have to put it out there and show what we can do or not do, which I think is great, but it also holds us all to a certain level. And it's a shame to see how woke or weird social media is getting about before and afters. I think it's a shame for patients because that's the content that they do want to see. And I don't think that we're trying to encourage people to chase a certain ideal aesthetic. We're just helping educate what surgeries can do for people.
And it's just interesting to me that it would be like, oh, okay, because you put it before and after, you are automatically sending the message that something's wrong. But I can do a before and after of a makeover, and that's not, to me, that's not any different. Obviously, there's a bit different price point and there's physical changes, but it's the same idea, is that you're doing something that makes you feel better. So why is it so bad when it's plastic surgery, but it's not bad if we color our hair? It's not bad if we, put something on, or we camouflage ourselves other ways, right?
Yes, I think that's such a great point. Like it seems like such a double standard, and it almost adds more shame, this like taboo to plastic surgery. We don't need any more of that. And I know, being Southeast Asian, I feel like in our realm, plastic surgery has this like a huge taboo to it. And it's very confusing because Indian people have plastic surgery. We just you can't talk about it. You should never say anything about it. And I don't know if old school thinking was just once you have your kids, you let your body go. But that has definitely shifted. I remember, I think I was 8 and my mom was like, I'm going to have a hysterectomy. It's a really big deal. Everyone has to take care of me. I was like, here we go. And I remember she came home from the hospital and she had like incisions on her eyelids. And
They slipped.
I was like, they took her uterus out through her eyes? I was like, that's amazing. This woman never said a word. She had a full tummy tuck, upper lid blepharoplasty. I went into plastics, never told me a word about it.
That is an amazing story. I would have told that on my interview trail.
And I was like, Mom, you clearly didn't. You had a mommy makeover. And she was like,
Yeah.
It was none of your business. But I just think that's funny. But I think like it's great you talk about, that you've had a tummy tuck and, I think that needs to change. Do you feel like that about the culture? Like, I don't know what you're.
Yeah. So I always joke that my mom, normally if you have a plastic surgeon in the family, you have family members who are like, yeah, me free. Not my family. Or at least not my mother, right? Like my sister, yes. But my mom was just like, I think one time she let me do like a little filler. And I think I'd done like 0.1 cc. She's like, are we done? Are we done? I mean, she goes, it's unnecessary. You know why? My mom was actually the person who took me home after my tummy tuck because my husband was working and watching the kids. And she like told me, she's like, he comes out and he starts telling me how great you look. She's like, is she alive? And I'm like, Mom, I'm clearly alive. I mean, come on.
Oh my God.
But it's just in her brain, it's unnecessary. So why do it? Right. But my kids know I did that. And even though my daughter was going around telling her in the neighborhood that I had my butt worked on, and I was like, don't stop telling people I didn't have anything done to my butt. But like,
she had huge butt implants.
I didn't want to lie to them because to me, if you're lying and hiding it, there's something shameful about it. And there's nothing shameful. I literally was like, you guys stretched my body out and I wanted to feel better. So I did this. And they were like, oh, okay. Like it didn't have to be something crazy. Yeah. And I feel like I personally have had Indian patients that I've taken care of who are very secretive and have the most interesting stories. And I'm just like, why? And it's because that sense of shame. And I feel like if we're just honest with it, there's actually books out there. Like there's books for all sorts of surgeries. And there's literally a book about how to explain to your children, mommy's getting a breast augmentation.
Yeah.
And it's because why not be honest? I actually think if we're honest with our daughters, about what we're doing, then they're going to feel more free and open to discuss things as they should be. And then it becomes less of, I feel a way, but it's wrong.
Yes. Yeah, I totally agree. And like, even though my mom didn't disclose it, secretly knowing that she had plastic surgery back then in like, the late 90s when it wasn't culturally like the thing to do, that made me feel so much better about being like, look, after I'm having kids, I'm going to have a tummy tuck. I'm not going to feel selfish or weird or crazy for doing that. Like, I think that was kind of badass that my mom did it, even though she was incredibly secretive and over dramatic about it. But I love that.
Most dramatic hysterectomy ever.
But I like that too. And it's awesome to see the culture shift happening where I do think Indian women are more open, and other cultures that used to be like more quiet and secretive about body change and stuff are becoming more open to it.
And I think a lot of it is because people share. I think social media has been a huge part of that. But yeah, and I think that younger generations are seeing that, like, we can still be us, right? We can still value our culture, but like maybe think differently in some ways and it not change who we are, right?
Yeah, absolutely.
So there are a lot of things this year, I think, that are changing in plastic surgery, right? So we're seeing a trend towards the more natural look. And I always like to say that natural doesn't necessarily mean you're not doing anything. It's just what the aesthetic people are liking. Are you seeing that in your practice as well?
Yeah, absolutely. I think one of the biggest, I will self-admittedly say I have probably a smaller breast aesthetic. I was built, I don't have huge breasts, and I've always kind of drifted that way, but I've definitely noticed in terms of breast augmentation alone, you've seen there is a big shift in terms of not bigger is not necessarily better. And one of the things that you always hear in the background is when women are talking about implants and we're sizing, we're trying to find the right implant, they always have a friend who's like, I wish I had gone bigger.
I know.
And
Yeah. Yeah.
I feel like that statement alone like really needs to be expanded. And I try to talk to patients about that. And at the D part of it, I feel like it's the grass is always greener on the other side. And, you know, like with anything, like when I got lift for the first time, my lips blew up and I was like, oh my God, I look crazy. And then day 2 or 3, I was like, no, this doesn't look so bad. But when the swelling goes, you're like, I kind of miss that. But as humans, I feel like we're always searching and wondering what if, what if, what if.
Hmm.
But you really can chase your tail and get into a place you don't want to be if you let that kind of take over. So I really spend time with my patients trying to find their goals and really talk about implant sizing and not try to rush through it or make them feel like I just don't want a patient to have that regret afterwards. And I think that as we take more time to do that, I'm hoping that's that constant, oh, I wish I'd gone bigger. You should go a little bit bigger than you want to go. I think that I've really seen downtrend recently.
I agree. And I think a lot of it is I think that in general, plastic surgeons spend a lot more time discussing, especially in augmentation consults. It really was in the past. You want to be bigger? Let's see what you wake up with, right? Like, I mean, I've had older patients, had their implants 20 plus years ago, and they're like, I don't know, I got whatever the plastic surgeon put in me. And I'm like, that blows my mind. I can't even imagine that. But so I think that is, if you spend more time, then there's less uncertainty with what your result is going to be.
Yeah. Another trend I'm happy to see kind of go away is like the huge butt is finally fading. Like an athletic BBL is great. And I think finding balance in our bodies is amazing and using that. But doing anything in too crazy of an excess, I feel like is really exiting stage left. And like even Kim K, everyone's kind of calming it down, which I appreciate.
Yeah. Well, and I think extremes of anything, like you said, it's just, I mean, yes, our job is modifying bodies and faces, but even then we still have like an endpoint, I guess, with things. So, what I think the other thing that I find interesting with, we're going to more natural is that we're seeing also an increasing number of female plastic surgeons.
Mm-hmm. Yeah. And it's funny because it just makes sense when you like think about how much of our patient population is female, and a lot of the changes are so female related. Like there's so many of my patients who are going through the unfortunate changes of menopause where you're really collecting just a lot of bulk in your trunk from estrogen fluctuations, and that can be so frustrating, and already a time where people are having a lot of self-confidence issues. It's just the cherry on top. But it just makes sense to me. And I know that not everyone's going to love hearing that, but I feel like we are absolutely supposed to be the dominant force in plastic surgery.
That's okay. We can always say things are wrong. And I mean, it's not to say, I have male partners who are wonderful plastic surgeons, but I do think that there's just certain things that sometimes we understand because we're women and, and sometimes we see a different perspective. Right. And the more that you can connect with your patients, then the more you can help them achieve what they want and not necessarily what you want.
Yeah. Like one of the things I noticed, I used to work for like a male plastic surgeon, and our post-ops are fascinatingly, were so different of the things like I would talk about with my patients. And it was funny because I would watch his patients and they'd be like, everything's great. I'm fine. And then when he would leave the room, they'd kind of start just spilling out their emotions to like the MA or someone else. But my patients feel okay just sharing that with me, which I appreciate. And one of the things I don't think we talk about enough is that first, I'd say week or two after plastic surgery procedures, especially big body work, there's like a cloud of general anesthesia, pain meds, you're recovering, but there is a tick up of anxiety, depression in our patients. And I talk about that with them beforehand, and I think that helps them set up the right way. But women, especially in that recovery phase, you're being pulled out of your normal routines. You're not helping your kids and your family, and you're having to ask for help for little things that we are so bad at doing. Like, I hate asking people for help. I'm like, can you give me the remote control? Okay, can you put my binder back on for me? Can you refill my water glass? Like, that's never a comfortable spot for so many women who are used to just doing it all. And that, I think, really contributes to that tick up of depression, guilt, anxiety that people experience. And instead of going through that alone and just crying by yourself, I think it's so helpful to be able to share that with your surgeon, have a heads up about it, and know that the sun will shine again and that's going to all pass for you.
Yeah, and I do the same. Like, we all know that that's coming. And so if you're prepared for it, then it's almost like right before you get your period and you're like, the world is going to end. Why do I feel so sad? And then you're like, oh, I got my period. And it's the same kind of thing. It's like, oh, okay. Like, if you kind of know it's coming, then it's a little bit easier. And like I said, it's not in any way putting down our male colleagues. It's just that sometimes you just feel more comfortable saying something to someone who understands in a different way.
Yeah, absolutely. It's kind of like when you have, like, when I had my first baby, even being a doctor, was not set up, and like just found myself hysterically weeping at random moments. And I am not a crier, and it was such a like bizarre experience, but I just didn't find myself in an isolated cave instead of like.
Sounds like residency.
Exactly. But after going through that, second baby didn't do that and knew it was going to come and got through it much better. But yeah, I think setting those expectations, having a heads up, and being able to talk about that is so helpful. But no shade to our male colleagues. I think there's amazing male plastic surgeons as well.
Yeah. But like you said, there's just always different views and different standpoints. And some people may just feel more comfortable with one or the other. So just knowing that there's different options and different styles. So it's why you should really research your plastic surgeon so you find the right match for yourself.
Yeah, absolutely.
Yeah. Well, this has been so fun chatting with you. I can guarantee any of our listeners that if Dr. Reddy is taking care of you, you're getting like that extra level of personal care. If people would want to find you, what is the best way for them to find you?
Yeah, Instagram is definitely going to be the best way to connect with me. We have a website, reddyplasticsurgerygroup.com, but also my Insta handle is kreddyplastics. And that is a very easy way to connect with me directly. I do try to go through all of my DMs like 3 times a week and make sure I answer everything, which is fun. I love it. I just have to, I'm terrified to check my email, but I will check my DMs.
Priorities. That's okay.
Exactly. Like, I don't know how you do all of the things you do. I feel like, I've only had my practice open, we're for a year in solo practice, and I just feel like every day I'm like just barely treading water, keeping my head above. And I'm like, next week will be better. And then it's just as chaotic and crazy.
So you just keep going one day at a time. And every time I have this personality that every time I get to a comfort level, then I'm like, what else could I do? And so, it's, I think it's sort of what makes us really good surgeons is that's a lot of our personalities is that we're always like ready to, we want to do a lot of things and we multitask and, we like to be challenged,
Yeah. You're a glutton for punishment.
Unfortunately, yes. But
yeah.
Well, thank you so much for joining us on the podcast. And thank you everyone for listening in today. Hopefully you got some really great insights. Please check out Dr. Reddy's Instagram page because she has lots of insightful things for you to learn. And we will see you next time on the Confidence Doc podcast.
Appreciate your time so much. I look up to you a huge amount, and thank you so much for having me on.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.